And I hit the actual button. All right.
So, good morning, everybody. You can introduce yourself. Good morning, everybody. This is
Dennis C.
our third time. Trying to give y'all some first aid while you're underway. It's an unusual situation for when you're on a boat and you have a medical emergency, because you are not within 5 minutes of definitive care. And it's essentially, you're in the wilderness when you're out there. So very similar sorts of skills are needed on a boat when you're underway as you would have if you were out backpacking out in some remote location. It's the same sort of stuff. So what we hope to kind of go over is discuss some of the likely things that could happen to you and some of the things that you might want to do in order to try to resolve those issues while you're on your way in to try to get absolute definitive care. And we'll talk about some CPR and things like that. Maybe get you all the first thing. I mean, I had CPR certification before. So most of y'all. Okay, so it'll be like a review. You'll teach me. Sure. What do y'all worry most about when you're out on the boat for your own personal safety? Anything that comes to mind?
My wife shooting me.
Violent. Hey.
Staying on the.
Yeah. Wild dog. Wild dog.
And the boat's in reverse, right?
Yes.
That's when it happens. Okay. Anything else? What do you think? What do you think some of the more common problems that you have out on the boat might be?
Head injuries.
Head injuries. Yeah.
Staying on the boat.
So you're talking about real burns, right?
Rent burns or
Not sunburns, right?
or sunburn.
Yeah, sunburns. They're fairly common. Any others?
Broken fingers, broken toes.
And broken things. Musculoskeletal.
Cardiac issues.
Cardiac issues. Okay.
Seasickness.
We've had them.
Here's a big one: seasickness. Especially when you got, guests, right? So guests have a real hard time with this. You go out a lot, you kind of gotten used to it. What about the hydration?
Oh, yeah. Drinking too much beer.
Vertigo.
Well, vertigo, that goes with seasickness.
Yeah, it sure does. It
So
ain't fun.
I haven't had anybody yet experience vertigo in an isolated manner yet. Not saying it won't happen, but you have on the boat, and it wasn't seasickness. You gotta stop putting them up in the mask.
My wife had an acute attack in September.
So as we get older, I think we end up with problems with that. I don't know. Some people, as you get older, you might have an incidence of vertigo maybe once every several months or something like that. Something to do with maybe, especially when you first get up out of bed or something like that. Those are all in that category. Hopefully it doesn't happen when we're trying to be ambulatory. You're moving around and that happens. Boy, that's debilitating. And we'll actually talk a little bit about these things. Anaphylaxis. Anybody got any allergies or anything?
I do.
Possibility.
Bees.
A lot of people have fish allergies. How many here have a motorboat? Okay, so
I got a motor on my boat.
right. Most people that have an outboard, for example, even though the probability is extremely low, the consequence is extremely high, and it's called a propeller strike. So that's something you like. So like on our Sea Scow boats, we carry tourniquets just for that particular reason, because if you don't get that blood stopped quickly, they're gone, right? So, and we're actually getting ready to teach them how to put on a tourniquet while they're in the water, because it takes a while to pull somebody out of the water in a boat, right? I mean, I mean, the boat's up this high above the water, you can reach down and grab on the boat. No, you're probably gonna have to hop in, put the tourniquet on while you're in the water. So we're gonna do that in the pool next time we get it.
And if you're talking about people in the water, hypothermia is another concern.
Yep, especially on the shoulder seasons and in the winter. Less of a problem, obviously, in the summer, but it can happen slowly in the summer. All right. So, what, just to kind of lay out the groundwork, if you guys got questions, ask them. If you are a medical professional, please chime in if you think I'm missing something or I'm putting out something stupid or anything like that. I've had no problem. I have no pride. That's can lower me and you more. So, let's see if I can get the presentation work. All right. So we're going to talk a little bit about medical planning and prevention, the communications that you might want to have. You know, if you're remote, you want to have some communication. Any resources that you might want to have in addition to first aid stuff. Things like, what do I need to maybe resolve an issue that isn't really in my little first aid kit? Triage, we'll go just really quickly over that. That basically is discussing, you know, this notion of the distracting injury, you know. Ow, 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 my foot hurts. Yeah, but you got this big cut in your neck, you know, you got, you know, some triage falling like that. Talk a little bit about medical kits and seasickness, lacerations, major hemorrhages, burns, hypothermia, fractures, carbon monoxide poisoning, and that's a eye problems, shock, and head injury. So I don't have any behaviors. I'm not a doctor. I'm not a doctor, by the way. I'm just an instructor for ECSI and Red Cross, which means my knowledge is about this big. You know, to be aware that I might not know everything. If you want to see some references, by the way, we're talking about resources. I've got several of the books back here that we use. I'll show you the good ones. I'll show you the ones that we won't bother with. Okay. So if you take a wilderness first aid course from me, you end up with one of these. This is a field guide. It talks about how to do just about everything. And it's alphabetized by the injury type. It's pretty easy to follow. Okay. This one's called Advanced First Aid Afloat. It's okay to get a book that tells you how to do all kinds of stuff. Right. Keep in mind, many times these things are written by doctors that don't understand that you don't have that same skill. Yeah. But it might be helpful, or use the same words, right? And then don't use this book. It says scouting on it, but they miss like one of the major complications and injuries, and that is there's nothing in here about shock. In this whole book. The scouts put that out. I can't do it. Be aware that not every book is going to be perfect. Okay. So what we're talking about is usually there's two types of things we're going to talk about here. One of them is if you're just out here for a day sail, you know, as soon as you let go of the lines, you're more than 5 minutes away from definitive care. It's probably going to be a couple of hours possibly before you can get somebody in. And so we'll discuss, you know, what you might do in those circumstances. And we'll talk maybe a little bit about when you're really over the horizon and, you know, rescue might be more than 24 hours. Okay. Who's been on this this race going up there?
Not the race, but about the trip.
So
Made the trip.
made
Made the
Not the
trip,
race.
made the trip
Made the trip.
dozens of times.
Former Commodore did this trip and got right about there and had to turn around and come back, right? Because they had a medical emergency on top of a flooding cabin. So they had both. So sometimes things happen. And medical emergency, by the way, it was really weird because when they pulled back in, it was over. They couldn't wake him up. Truman went to sleep and they couldn't wake him up. And they pulled back in. When they finally woke up, he said, "Ooh, what happened? Why are we back in Norfolk?"
Wow.
Did they report it to the Coast Guard?
I don't know.
Because it's required.
Oh, yeah.
Yeah, let Steve tell a story.
Oh, yeah. Tell you what, well, I won't get the details, but, you know, when you finally, we had a medical emergency, a guy had, come out of the head, got thrown across the boat, slammed his head into the microwave, was bleeding. It was blowing 40, 45, that kind of thing. It was over a long weekend. And so we finally got back to Norfolk. We had a surgeon on board, a guy who worked in the emergency room. He ended up going to the hospital because he backed out again. But I called to try to find out who it recorded to, and I got pushed around. 3 to 4 different agencies, Coast Guard, Virginia State Police, everything. Anyway, I ended up reporting it like within 48 hours or so. Well, that was outside the tolerance window. I got a notification on my Coast Guard license that says I failed to report on time.
So you got a Coast Guard license. Okay. So I teach motor safety for the state. The state requires notification of an injury that requires medical treatment at a hospital to be done, within 48 hours. Yeah, so you've got 10 days for anything else that happens. But if it's, you lose somebody overboard or a medical emergency that requires hospital intervention, that's a 48-hour thing. That's the state wants that, which is the Department of Wildlife Resources.
None of us really know that, though.
I was gonna say,
Recreational people.
that applies to recreational people too?
Yeah.
Yes.
That is specifically for recreation.
Yeah.
His Coast Guard license changes everything. Because
still a
once he gets a Coast Guard license, he is now a vessel of the United States.
Right.
And federal law guides what his reactions are supposed to be.
What if you have a documented vessel?
That's
Like you're on that race, so you're not in Virginia state waters in a documented vessel.
interesting. That I don't know that.
That was the complication. We were offshore. We were not by Virginia, but we were up by Delaware. The question is, who do you report it to? Anyway, it just
Yeah. Interesting.
Once you're 12 miles off, you're not in any state.
right.
Okay. So this is
My question is, what happens if you don't?
his license, if you're just recreational, nothing happens.
Okay,
Okay. If you've got a license that is issued by the federal government, then they got this program like 3 strikes you're out kind of thing.
got it.
I
How
think,
many strikes?
no, I think you do get a nasty letter. I think you do.
It's not like what.
Yeah, it may mean nothing, but you get a reprimand.
Well, here's the issue. It's the same issue about anything else. Is if the person that's sick ends up dying or has a major issue, then they'll go back and figure out what did you do to prevent that casualty. The problem that you run into when I called the Coast Guard, I said, and what happened if I called you on time? Well, we couldn't have done anything. It was just an administrative thing, but that's the problem.
Yeah,
Like
data
anything else.
gathering. This whole thing is about data gathering. Is what they do is this is so they annually can say this is how many accidents, this is how many injuries that can. They're probably, if you look in the Virginia code, you can probably look in there and say, oh, will Virginia will it be like a class 6 misdemeanor and they'll fine you for $100 or some stupid thing. But I don't know exactly what the.
Or if there's casualty, then the insurance company could
Right.
define the action
could.
taken as negligence
They could.
or not to.
Yeah.
So I've had to report once. I've had one collision. It doesn't take long to do. It's not a big deal. There is a form that you fill out and you send it in. I actually scanned it and emailed it to somebody is the way I did mine. They have a field box you can send it to. So it is embarrassing to have a motor safety instructor have an accident on water.
Means you're on the water.
So planning and prevention, the big part of planning and prevention is first of all, you're going to have a first aid kit. Know what the physical condition of every member of your crew is. In the Scouts, I have a form that every kid fills out, and I know what their allergies are, what their conditions are, what medications they're taking. And even a doctor may even say, "Hey, you got this problem. You probably shouldn't go, be 5 minutes away from rescue." That kind of thing. So understand what all your crew or passengers are going to be like, because it's better to know and ask them to stay than to take them and have something bad happen to them, and then you've got that in their hurt.
Norm, the way we do that is we'll have every crew member fill out that form and anything else, put it in an envelope
Yeah.
and give it to the captain.
And the reason why the captain needs it is if the evacuation occurs, you put all that paperwork with the victim or the person being rescued or whatever they call it. And so that they'll have that information wherever they go. Another thing is that preparation is get some first aid training, okay? Some formal first aid training certification. There's some things that go with that also. You ever heard of a SOAP note? So SOAP note is subjective, objective, assessment and plan. It's basically a piece of paper where you write down the result of a questionnaire to a victim about what their conditions and things like that are. And then also a physical exam on the spot to find out what really is wrong. Okay. So you learn about that in a wellness first aid course. And then an assessment of what you think is wrong, and then a plan. And you put that with the victim when they go to, so that the rescue squad people know what's been done. Things like how much medication have you given? When did you put that tourniquet on? That kind of stuff is good to have on that. So other things to plan is have a good first aid kit and have everyone understand where that first aid kit is and the basics of how to use it. All right. Because what happens if you're the victim, right? You want to make sure that everyone on your boat knows how to do some basic stuff. So this is all about when you're going far over the horizon. If you're only going for an hour drive, hopefully they'll be able to get the boat back, right?
The other thing if you're going far away is in the ditch bag, you should have the critical medication for each of those people that are there in the bag.
Yep.
So that and a copy of the whole medical form in the bag too.
Yeah.
So that they've got it. So if they have to spend any time in a life raft or whatever, they've got what they need.
Now, the ditch bag I use is a dry bag. So you actually can put the health forms in there.
Yep.
Probably want to have a separate ditch bag, separate bag within the ditch bag, because you're going to have to open that ditch bag when you're in the water, right? You probably don't want to ruin all that paper.
If you get the Waterway Guide news article that comes out once or twice a month, the most current one has an example of the ditch bag with everything that could be in it or might be in it. Not necessarily as a resource to take a look.
And if you're interested, we can talk about that later. Okay. Immunizations, that may be a bit of a political topic, but if possible, get some immunizations. The top one is going to be tetanus. It's real easy to get tetanus if you're not vaccinated. There's a bunch of them there, but some people don't care much for vaccinations. But even if you don't like vaccinations, get a tetanus. Go on Wikipedia, look at a picture of what somebody with tetanus looks like. That'll convince you to get tetanus. Okay. Pre-voyage briefing, this is part of your preparation. Get everybody to understand what we're all doing. Don't worry about this HIPAA crap. HIPAA is for professional. Doesn't matter to us, right? Have their personal medications twice as much, and that's why you put part of it in the ditch bag. Okay.
It's good.
Now, communications, if you're open horizon and you need help, I mean, like urgent help, you need some satellite phone, TLB, something like that. If you can reach out. The Garmin makes all kinds of really great products to do that with. They're fairly reasonable price. There's some other ones out there. The Garmin products will actually work with your cell phone. So, you don't have to figure out a new interface in order to send a text message to emergency services and say, hey, can you give me some help? We got this person with this problem. What would be the best way to resolve this? And it may be that there's a helicopter on it, but it might not be. It might be that it's too dangerous for the rescue people to come get you. Well, they go through our assessment about, what's the risk. So if there's a life at stake, they'll probably come out, right? But if we've got this being partially resolved or steady state, it probably won't. They'll probably wait for you to bring them in.
We ought to talk about what we learned a couple of years ago about if you have a VHF radio that's mounted and you don't have one in your hand, you're missing out. Because if you have a problem with the boat, you probably turned off the electricity. You no longer can talk to anybody, so having a handheld is really important.
And that goes back to the ditch bag. Mine's in the ditch bag. My hand.
That was the JDA experience.
most of this discussion about iridium prices and all this is outdated, and I think this presentation might say. There are remote telemedicines that you can maybe get subscriptions to if you're gonna go over the horizon. I actually advise that. You know, in addition, plus, when you go, get into the medical kit, when you get ready to go, you would consult your doctor and say, hey, will you write me a prescription for this whole big list of stuff that I want to take just in case? Things like, antibiotics, the really good eye care stuff, most of those things are prescriptions. But they're not dangerous in themselves. If the doctor trains you on how to use it, it's all good, right? If we're going to do diving, Divers Alert Network, and then know how to get a hold of the right rescue spot in the right Coast Guard.
Now remember that it's no longer District 5. It's the Southern District. In
Yeah.
fact, you notice they've changed those. You'll see a lot of things where District 5 is still mentioned, but it's in kind of in quotation marks or parentheses because it's now the Southern District.
Okay. That telephone number still works.
Yeah.
Yep.
So that's a little further north. We got all these. So rescue, if you're way out there, you got no other choice. They're going to send a helicopter to come get you. If you're way, way, way out there, they won't even be able to do that. They'll direct some commercial guy to come get you. All right.
We'll send out a C1, yes, you got a C-130 and drop you some life rafts and stuff. They can do that. They can drop in a paramedic as well from the C-130.
Now, what I don't know is let's say you had an emergency over 10 miles off of Cape Charles. Talking about the town of Cape Charles. Will they just come out in the rib? I think they will. I think they'll just come out in the rib. I think there's ribs here somewhere. I've seen. But then we're not really very far away from anything. So the idea is that you use Channel 16 to call for emergency help, and you arrange to have, say, hey, I'm heading towards Old Point Comfort Marina. Can you get the rescue squad there for me? Because you might be out of cell phone. So I would ask the Coast Guard to get a rescue squad waiting for you there at the. And you never know. The fireboat may take off and come meet you at Heartland. You never know. Nice fireboat. Have y'all seen the new fireboat out there? It's nice. So this is an example of something happening offshore. That was during the hurricane that sank two ships. Sank this one and sank the Farah, if I remember. It was the same hurricane. So this was a situation where they did get rescued, but the captain decided to kind of go down with the ship. And unfortunately, he did not survive.
God.
Worry about liability. We're all friends, right? Yeah. So if you're doing, one of the big races and you got crew members that are helping you out, I suggest insurance. Help you out with that. Rescues are not free. Okay, they'll cost you money. So it's good to have insurance for that. There's a company that is collaborating with Garmin that will provide you that insurance. It'll give you, like $100,000 for rescue. And it's very inexpensive insurance. And you don't have to buy it for a whole year. You can just buy it for a period that you're out there. That guy went to jail, right?
Yep.
That guy didn't survive. We're going to stick with the triage, because I think that's just. If we end up with multiple casualties, you're going to be freaking out and doing the best you can anyway. What they were talking about, the reason why I'm bringing this up, they're talking about in triage, you're going to treat what's going to kill them first. So if I got multiple casualties, one of them is screaming because he got pain, and the other one is dying, you give the one who's screaming, give him some Vicodin, and then you work on the other one. That's what I read out of that.
Gain control from a doctor. have to have a prescription.
I know.
Anxiety and panic, that doesn't grow. And then diazepam, you gotta have restrictions. So the basics for when things go really, really bad, horrible bad.
I guess that's it. What happened? Yeah, someone just emailed them lost audio. Somebody had a button.
I actually recommend check yourself, unless they're blood. I recommend that you put on gloves to do this. Nitrile gloves would be what you really want to have, but these were given to me. This is fine. These are vinyl gloves. A latex, there's people with allergies on latex, which is nitrile. So see if you can still no breathing. Okay, now you come down here, get directly over them, over the chest, knees close, arms straight, and if you want to know where to put your hands right directly between the nipples or a little bit below, but don't put it down so low you're crushing this thing called the xiphoid prostate. But right in between the nipples is just fine. This will take effort, and don't be surprised when you hear something go snap. Okay, that's when you know you're doing good when you break the rib. So 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. With 2 breaths. So what you do is you lift up, tilt the head back, head tilt, chin lift is what they call it. That opens up the airway. If you've got a breath barrier, put that down. I'll give you all of those today. But basically, make a seal around the mouth, close the nose, put in 2 breaths. Watch the chest rise. If the chest doesn't rise, and it's probably not an open airway, you need to reposition the head. Okay? Give another breath. Then immediately get back to this. 1, 2, 3, 4. So it's 30 to 2 for, child and adult. All right. Infants, it's a little different. It's 15 and 2. I don't think I'm going to have the infants on board. And the idea here, now, if you have an AED on board, and you bring that out, I'm not going to show you all that today because most of us don't have an AED on board our boat. There's a good reason why you don't. They are vulnerable to seawater corrosion. They die very quickly because they're not conformally coated. I was telling Dennis earlier that they don't even put them in the area of a swimming pool. They're going to be in the front office of every swimming pool because the chlorine in the pool, it's in the air, it corrodes the AED. So, although AED is real helpful in these circumstances, so you just continue this CPR until they either ROSC, which is return of spontaneous circulation, they start breathing. You're too tired to handle it anymore, or you're relieved by somebody who knows what you're doing. The hard part on a boat is finding a nice, big enough flat space to put him in there. So when I drill with the kids, I'll go in there and I'll fake a heart attack, and they got to figure out how to lay me out in a boat. And it's not as simple on a 26-foot boat to lay out a 5'9" human being who weighs 200 pounds with a bunch of 98-pound wonder doing. So it's tough. So that's something to think about It might even be worthwhile to brief, okay, if this happens, this is where we go. Right, something like that. Questions about CPR?
Can you move the person, like if they're in the floor of the cockpit, you could put them on the other cockpit?
You can, as long as it's not a bench that's gonna be soft. Okay, it needs to be a hard, because when you push down, you need for the body not to push down with you. Remove cushion. Right. So like on my boat, that's actually a perfect way to do it. That's what I teach them. I say, take cushions off of, the port side, bench and put my fat body on that, start doing that, because it frees up the passageway, and there's literally not enough room in any passageway on my boat to lay me in. So they have to be. Well, I gotta give them away or else I'll just throw the other.
Yes.
Yeah, when you're pushing in, you're gonna push in 1.5 to 2 inches. That's a long way. Okay, don't be meek about it. Push, push, push. The effectiveness of compressions is what is going to cause you to have better outcomes. Even with without compressions, chance of survival decreases about 10% every minute. Okay, without compressions. With compressions, it's slightly different. Okay, breathing, although we talk about it, if you don't have a breath barrier and this is a stranger, I would just do hands only, CPR, and probably not do breaths. If I don't have a breath barrier, because I don't want to catch whatever it is. Because it's obviously legal. I think this would be hard to do on the road.
Absolutely.
Yeah, pick the high side or low side. Pick the high side and you land out on the bench, you might slide off the bench.
And if you're sailing, you're probably going to tap. Now, on my little boats, our emergency procedure has us lower sails get on the motor. Because there's not much difference between motor speed and sailing speed on my little boat. On y'all's boats, you might actually be able to, exceed hull speed when you're sailing. But I can't.
Well, it's also how much time drop the sails.
Oh, and I didn't talk
Keep
about
the
that.
boat in sea. Right?
Yeah, and that's the first thing. I didn't even talk about that. That sequence that goes in your head. The very first thing when an accident happens and obviously somebody's hurt, first thing is to make the boat safe. And then you can tend to be the victim. So you got multiple crew, you can do two things at once. But if it's just two of y'all, you don't want to sail up onto a beach while you're giving CPR. All right. Airway, breathing, circulation. So airway, we were checking. The airway was open. Check for breathing, and then the pulse checking for circulation. That's what I'm at. Oh, medical kits! Woo! Medical kits. All right, so these are the training ones that I put up. And these are very abbreviated. What they got is it's got the contents for stuff that for the problems that I present to my students. So it'll have like sand splint. Y'all know what this is? Sand splint is what you can use to help temporarily resolve any sort of musculoskeletal thing. I think I demonstrated earlier today how to splint a forearm. These are basically foam coated aluminum. This is the really long one. Around there, and you go ahead and get some of this wonderful. Now, a lot of people like ordinary gauze for wrapping things. I like this clean stuff. Cobain. This is magical stuff. Because watch this. When you get it on there, it stays. So,
Someone does.
Once it's got a little dirt in it.
but then when it comes off, it doesn't tear all the skin off. I also like leaf tape, and that would just tear everything. You can wax that. So essentially you put that on there, immobilize that nicely. If it's broken here, you want to split it all the way from the joint above and the joint below. All right. So if you got a femur that's broken, this ain't going to cut it, right? What you got to do is get a paddle. Okay. And basically, if you got a femur that's broken, you need a paddle. And you stick the paddle under the armpit and all the way down to the ankle, and wrap it all the way down to immobilize that femur. When you've got an injury like that, and any sort of break, you need to monitor all kinds of vital signs. Okay, you want to check, pulse, breathing. The most important thing to check in these is what we call CSMs, which is circulation, essentially. So you can press the fingernail and get capillary refill, because if it doesn't refill, you push it down and it stays, really pale white, and that's an indication that they're not getting blood all the way down, right? And that can happen in a fracture. In the case of a femur fracture, it can be so bad you can actually bleed to death with a femur fracture, even if it's not complex. So the other thing to check on is for shock, and that would be, level of consciousness is the best way to determine whether someone's going in shock. Continue to talk to them. When they start losing the ability to think straight, and that's a lowering of consciousness. And when you take a first aid course, they'll tell you 4 different levels and all that, so that you can kind of measure how bad it is, and if it's getting worse, it's kind of going on. But that level of consciousness is a big indicator of there's not enough blood going to the brain, and without blood to the brain, you die. The kind of medical, they call it perfusion, right? Yeah. So you got to make sure there's plenty of oxygenated blood getting to the brain. That's the most important one of those organs. If you don't, you can detect it through either level of consciousness and pupil dilation and all that kind of stuff can help you with that. But level of consciousness, talking to them, do they know who they are? Do they know what day it is? Do they know where they are? Do they know what happened? Okay. As they start, as they lose oxygen, they start losing the ability to answer those questions progressively. Okay. And then when they can't, eventually they're going to go boom, 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 boom. And that's what you get. That's called verbal response. That's bad. Okay. And then the next one down is pain response. Says if you pinch them, they flinch, but they don't answer you when you talk to them. Okay. They can go south. So keep an eye on that stuff. Check their pulse if you can. Check their breathing if you can. Make sure you've got all that stuff going through. Other things that I put in my first aid kits for training, I put a lot of gauze pads, because I give them a lot of bleeding casualties and things like that. Bleeding casualties, I think most of those are going to come from just a couple of ways on the boat. Kitchen preparation. Okay. Another one is catching fillet. I don't think it's legal to cut up your own fish on the boat, right?
It's fillet and release.
Fillet and release. Fish hooks. You're not going to just pull them straight out. Fish hook. Push it in the rest of the way, cut off the barb, and then pull it. Now, I don't carry the proper tool to do that, so in my first aid kit, I got to go to the toolbox. It's possible that you end up, somebody's barefoot. That's another one that's thinking about preparation. Tell everybody, like I did, you're going to wear those good shoes in my foot. Because you stub your foot, and then you got a real hurtful pain, but it could cause blood, and I don't like blood on my foot. But that's another place that you come. And then the final thing of getting bloody is when you're snorkeling or scuba diving, you run up against some coral or something like that.
Hey, but you forgot the most important one. Working on the engine.
Oh, yeah, well,
I was gonna say maintenance.
but that's, hopefully that's just.
And we're hoping you're not just.
Good thing blood's not corrosive, the engine would be going.
It's time, it seems like I have to, you know,
Something.
the old motor sail with the boat heeled over and sucks up air. Anyway, the next thing that's kind of, you know, shock is one. The next one that's kind of tough, especially if you're out for a time, is infection. Infection is a very terrible thing if you're not going to be able to get back in the next day or so. Especially people our age, infection is very easily fatal. And if you're over the horizon, there's kind of two types of infection that you've got to worry about. One of them is if you get that cut that isn't well cleaned, and it becomes infected, and then you go into sepsis, right? Septic shock. Oh, both, that's possible. The other one is you choke on your food. And then you end up with particles in your lungs. And that ends up, you watch TV shows about it all the time, right? They say that particle, what do they call it? Aspirative pneumonia.
Aspiration pneumonia.
Aspiration pneumonia. They say that's the number one killer of people with dementia. Okay? Because they choke on their food, it doesn't all come out, and they got particles in their lungs, and it goes back. So, you might want to, if you're going over the horizon, get some really good antibiotics, because that might help.
Usually for that, we just I carry just Cipro is the one.
Yeah.
Because that covers, it's only twice a day dosing. It has a long shelf life and it'll take care of urinary tract infections, pneumonias, most skin infections. And so that's kind of the one if you're going to your doctor to ask for your, like you said before, getting what medications do I need? You need Cipro, Zofran, scopolamine, and something for pain. Yeah, the patches.
See,
Can be, I don't know if you're gonna watch out for it.
Yeah.
But scopolamine is the best out there. They give that to the guys in the Navy. It's a little transdermal pack, put it behind your ear, no more season. But 1% of the people have these other problems.
And just because this is my wheelhouse, if you're giving anybody anything, always check to see if they're having a reaction.
Absolutely. Yeah, absolutely. And yeah, you're absolutely right. The other thing I keep in here is a compressive bandage. Because these are really, really handy. The key to this is that after you put a compressive bandage around a limb, you want to check for CSMs, circulation, being able to move, sensory, make sure they're not tingling. Because you can make it too tight, and have limb dip. It's on there for people. So just check their fingernail and check for capillary refill every hour or so. That could be good. Or if they start complaining, arms them. Triangular bandages. When you saw me put the split on here, and then we would wrap this around and make it nice and tight. But then you just got to mobilize this whole system here. And the way you do that is you make a kind of a cravat that holds the arm in place. You can instead take safety pins. If they got a long sleeve shirt on, they can safety pin that shirt right up against the sleeve up against the shirt, and that'll immobilize it. The other thing you can do is they can fold this up like that and safety pin that. But the idea is to immobilize this whole system of motion so that it doesn't make it. You don't want the bones to move around and cause an additional problem. I don't carry any medications in my training kit. Because, you never know. Another thing that I put in, now this first aid kit is actually fairly useful. This is the one that I use on the boat. I put the basic first aid kit stuff, bandages, Band-Aids, other dressings. Most of that is all in here. Okay. And then I have usually, I write here, I'll say severe bleeding. Okay. And for severe bleeding, I usually put the windlass tourniquet. Okay. And nice big roller gauze. Now, if I was a rich man and could replace these every 2 years, I'd have clotting, clotting gauze. The purpose of this is, let's say that propeller hits them right here, right? And they're bleeding out right here. This ain't gonna help. So what you do is you pack the wound with this. And this is just get started. We've got more of them on the boat. And we basically pack that wound and hopefully stem the flow so we can get somebody back in.
All bleeding will stop with pressure. So the most important thing for bleeding is just to put direct pressure. And sometimes the best direct pressure is, if you have enough people, is just someone's hand and
Yeah.
just hold it before you go to tourniquets or anything else. Unless it's bleeding into a cavity that you can't get pressure on, I don't care how big the artery is, you can stop it with direct pressure. And sometimes it's just, depending on how far away help is, just keeping your finger on it. And that'll save a life. Don't worry about tourniquets and fancy dressings and clotting stuff.
Yeah, Israeli.
Just put your finger on it.
In my training days, I remember them telling me that more people are worse off because of tourniquets.
Yep.
They can be.
Yes.
So it's kind of a last resort.
That's the thing now.
Yeah.
Direct pressure. I'm sorry to direct pressure. The direct pressure will take care of most. In fact, you can actually kill them with pressure.
Yep.
Okay. But if it's spurting out from a big gaping wound and you can't find the vein to put the finger in like a little Dutch boy, you're probably going to have to put the tourniquet. And like the military says, high and tight. When you read Boy Scout stuff, they say put it 2 inches above. No, don't bother with that. High and tight, baby. Go all the way. Put it right up against, where the joint is. And now, what they also don't teach is that, once you've stemmed that blood flow, you can go to work on that wound, to pack it, and once you've got it packed, see if you can remove the tourniquet. If it doesn't bleed anymore, you don't need a tourniquet. What do you mean by packing? That's what this kind of dressing is for. So if you got a big severe wound like this, you can pack it with dressing and put pressure on it. That can even apply the gauze. Actually, if it's a big open hole, you can actually push gauze in the hole.
Packing is just a way to apply pressure. So, you just roll up a ball of gauze or whatever you get your hands on so that you can put it in the wound and put pressure on it. And then, especially if you're short-handed where you can't keep a hand on it till help comes, then you can fashion something to wrap around it to hold that packing in place. But all packing is just a way to apply pressure. Yep, to hold it.
This will just hold it in place. You might need to have a little more force than this does. This is why they invented the Israeli bandage, was to provide you the ability to put dressing in the wound and have a means of making it fit. Because what an Israeli bandage is it's just basically a big fat piece of cotton gauze that's got an elastic bandage on it with a little lock on it. So you can punch it in there so it's nice and tight. Now, I don't carry those because they're kind of special purpose. Like gunshot. Now, the other time, if you guys hunt, I advise if you go hunting, there's 3 things that I would advise in a hunting first aid kit. One of them is tourniquet. Another one is a whole bunch of roller gauze and clotting roller gauze if you can get it. But the thing is that stuff has got an expiration date and it's expensive. And then the third thing, you get a chest seal. Now, these aren't vented. I would suggest that you get a vented chest seal. So if somebody gets shot here, it doesn't kill them. They're probably not going to breathe. Because breathing relies on this being closed. If it's not closed, there's no differential pressure, and so the lungs won't inflate. So you wipe it off, put this on there. Now, why do they put two of these in the bag?
As it goes in. it
Yeah,
goes out.
where it goes in, it comes out, right? So you might have to put two of them on. But get the vented. That's what I use in first aid kits. This is just for showing off. But if these stick pretty good, but you got to wipe off most of the moisture, most of the blood, and you put it on. If all you got is this, and they start having this difficulty breathing, then we got a problem with, either blood filling the cavity or something like that. Just got it perfect. For the,
What does it mean by vents? Slits in the baths?
yeah, actually there are. Some of them have got a little valve thing on there, and some of them, it lets gas out. It keeps the gas from,
One-way bath.
it's a one-way valve. I've checked that. It's usually a flat. And you're not going to fill this cavity with gauze. Okay, you're just going to carry it. But you can at least make it so they can breathe. And anytime you're applying all this stuff that you mentioned, always watch their vital signs to see if anything that you've applied to them is making it worse. And then on the other side of the first aid kit, I usually put the meds on the boat anyway. Those are simple meds. I'm not going over the horizon, so I don't have the big $5,000 first aid kit. It's got everything. Basically, I'll carry ordinary topical analgesics, maybe some other analgesics that we can take, things like ibuprofen, Tylenol. I like a topical analgesic like Solorcan. I like that stuff for sunburns. Neosporin. I usually put a number of alcohol packets in there, but that's not for sterilizing the wound, because that hurts. I use BCK packets, which is a antibacterial thing, but it doesn't stain anywhere near as much. I use alcohol for sterilizing something that I'm going to touch them with, like tweezers or something.
You carry some saline.
I do. Actually, I do. And it comes in pretty handy. There's something that you guys, it's especially handy for eye wounds. Okay. If it's anything else that you need saline for, we're surrounded by it. As long as you're not trying to dump it into the body, you'll be fine. Okay. But for example, a stinging nettle sting, don't put vinegar on it. Not for the stinging nettles you see here. Just put vinegar on it. Don't pee on it. None of those things. Just use salt water. Actually, water out of the bay. First thing you do with that is you scrape the tentacles off the edge of the knife, credit card, something like that, plate, whatever. Just get all the tentacles off, and then rinse it with saline, and then give them some ibuprofen. It's not on the The saline's good for eye injury in particular. We'll see here, there's a presentation, part of the presentation actually talks about a really good, these are the expensive ones. But I always do something. Later on, they'll talk about, there are some eyedropper medicines that kind of combine an antibiotic with a steroid. And so what it does is it kills the pain and kills the germs. But it fits right. I actually used it when I had my cataract. Good stuff. Doesn't that? Probably expensive. And apparently lasts a long time and you can see.
What do you think about these home medical kits you're seeing advertised on TV that got medications in them?
Well, my main thing about medications that you buy in their kids' is they're usually halfway through their expiration date by the time you get them. And so I've gone to where nowadays I'll buy a first aid kit because I like the bag. Okay, it literally I'm down to that. That's why I bought this one. I like the bag. I think there's only like 2 or 3 things in there from the original kit. I build my own for the purpose that I'm using it for. So I've got a lot of stuff in here. It's not very boaty because I use this one in particular for hiking and things like that. They all have like blister care and things like that, which you don't need much of when you're on the boat. You're not hiking 100 miles a day. Focus your kit for your skill level and what the circumstances that you look at. If you focus on things like have something for sunburn, have something with the hydration, have something for ordinary scrapes, cuts. I would make sure that I would have soap on the boat, not just hand sanitizer. Y'all have heard of norovirus, right? Norovirus is a fairly debilitating gastrointestinal sickness that comes to us through the anal to oral pathway. And it's real contagious. Okay? It'll live on a countertop for weeks and still be active. So that's why you need to disinfect with chlorine, hand sanitizer. Norovirus laughs at sanitizer. It drinks and grows with hand sanitizer. So you have to use actual soap and water to get rid of it. So if you've got guests on board and things like that and they're using the toilet, I would suggest you have at least some way for them to get running water and wash their hands. Hand sanitizer is fine, for certain things, but it's not real good for that. It's good for COVID. And Clorox wipes. You would think that there's Clorox in their wipes. No, they don't put Clorox in their wipes. They put hand sanitizer in there. And BZK something, which isn't strong enough to kill more. You really need to sue. Intestinal problem. Now the mirror, right? This guy talks about there being 4 phases of it. Malaise, where they're just tired and sleepy. Malaise 2, they're apathetic. That's what a teenager is. All the time. Then there's vomiting, and then prostration. I haven't had that. Actually, I haven't. But it's not the end of the world. I mean, if you're going over the horizon, tell your guest who's going through this, we're going to keep you hydrated. You'll get over this. It will go away. Have sympathy for them because this is absolutely debilitating. It's absolutely one of the hard. Don't worry about them brand names. Okay, Dramamine. This is what actually treats it, and then you can give them some caffeine or pseudoephedrine or something like that. These are, I'm not doing that one. So, this is this guy's presentation. Now he talks about using Dramamine and caffeine second. I would have led with that. And then Dramamine, less drowsy, and Meclizine. Meclizine, you can use that for the vertigo. If it's
Is that the one that you get in the Virgin Islands or?
no, that's another one that goes.
Oh, that's Bona. I think.
Bonine is Meclizine.
Nectar, no, I know what you're talking about.
Meclizine is distributed as Antivert when you go to the hospital. When you go to West Marine, called Bona.
What's the one you get in the Virgin Islands?
Oh, I can't think of the name, but I know you can't get it in the United
You
States.
cannot get it.
It's European and here.
All our Brit.
Yeah.
The polyamine, transdermal,
Yeah.
Keep in mind there are side effects to that. There's a number of people who will have about 1% will have maybe really bad rashes, really bad itchy skin, insatiable The, the, I think insatiable thirst is one of them that pops in also.
Yeah, even if they don't get insatiable, they get dry mouth, that kind of thing.
Yeah.
And the thing, if you're gonna go over the horizon, is you got people with you, that even if they say they never got seasick, make sure they have something to do it, to take it, and tell them to try it before they get on the boat,
Absolutely.
to see what the reaction is, because they all react differently.
And all of these,
Sturgeon.
and all of these medications, they need to take it accordingly.
Yeah, once you have seasickness, you're not gonna, that's the one we're talking about.
Caution advice. And there's another, one of the Sea Scout skippers that I knew when I first started, he used to use C-bands and they worked for him. What works for me is be up topside and look at the horizon.
Yeah.
That's what we're called. Yeah.
If you're gonna, ginger snaps are good too, but you gotta make sure it actually has ginger in it.
Right. We had ginger ale one year. Turned out kid we gave it to couldn't stand ginger ale either. He just couldn't figure it out.
There are a lot of really good ginger candies now,
Yeah.
chews that are made from.
So they're.
They are.
Let's see who's doing last. Okay.
Before you go on, the other thing about seasickness, the most important thing is hydration.
Yeah.
You need to keep them hydrated. Just that'll help make them feel better, but also that's what kills people from seasickness is hydration. And the other thing that kills people from seasickness, and one of the first signs of it, is apathy. You just all of a sudden feel like you don't want to do anything, like change the sails, check the engine oil, or do anything else on the boat. And that's what gets people into trouble. All you want to do is just lie down and do nothing, and the boat will take care of itself for a while. So hydration and making sure that you're taking care of daily tasks.
Yeah. Oh. Here in the bay, you fire stuff.
And you said it before, but prevention is everything. I go offshore and I'll probably 1 out of 4 or 5 times get seasick. I put a scopolamine patch on every single time. And because I hate the way I feel, but that 1 in 4 or 1 in 5 times where for whatever reason the sea state is just such that you get seasick. And then when I'm alone or just with my wife, she can't handle the boat. She could get it home if she had to, but it ain't fun.
I think your point needs emphasizing because the apathy thing is what will kill you.
Yeah.
Because you're not going to get people sick until you're in bad situation.
If you're in charge,
To take action.
yeah, if you're in charge of the boat or shorthand, yeah, that.
Need to take action. They want to.
Pardon? Well, the interesting thing about seasickness is after 3 days, one patch lasts 3 days. I've never had a problem after I've taken the patch off. Because by then, right. So, but yeah, but yeah, exactly. So, yeah. And I'll say it again because it's not on there because that's an old slide. Because Zofran is the drug that you can use now. It's sublingual. It's got very few side effects. It used to be super expensive, so you can never get it. It's dirt cheap now. And most primary care physicians saying, if you say, "Hey, I'm going offshore, I need to have some on hand for seasickness," they will prescribe it because it's not. Yes. No, Zofran is just an antiemetic. It was designed initially with people with cancer, and it used to be like $500 a pill, and now it's generic and it's pennies a pill. And again, you don't even need to swallow it; just put it under your tongue. And that's the only one that I've found that if you have seasickness, it doesn't cure it, but at least makes it so you can function.
Don't need to do that. The doctor's just gonna tear it open when you get in and fix it.
So I'll comment on that since that's what I do. Yeah.
Cover on it, you know, stop bleeding, obviously. I mean, if it's bleeding, you gotta stop. You don't need to.
If you come into the emergency room with a fresh open wound, I'll take it, no matter how big it is, I can probably get it closed. If you come into the emergency room with a wound that you closed at home or on the boat, first thing I'm probably gonna do if it's anything looks infected is take your sutures out and then send you home for 4 or 5 days or even up to a month and then take you back and close it. So all wounds heal.
Like other types of clothes, scary strips, things like that.
Duct tape, anything,
Not
yeah,
duct tape.
but not too tight. Just give it so it has air in there.
He can also, if you put this out here, just cover it, bring it in, and go to the emergency. If you're 3 days offshore, 4 days offshore, I use those steri strips, but you got to make sure that wound is super, super clean. So you're going to use water that's good enough to drink, so flush it out, okay? And I mean clean it really good. If that means you got to get scrubby from the get in there, but do whatever you can to clean that thing out, like a road rash. But clean that out as best you can. I carry a syringe in here to basically flush wounds with. And then the last time you do it, if you've got a very mild concentration of iodine, you might use that. If it's a very mild, like really low percent, just enough to color the water a little bit.
I'll give you my 2 cents on that. When your dog gets a cut, what does he do? And what happens to that wound? It heals every time. My recommendation is just get the big chunks out. You don't scrub it, and you don't need to put anything else in there. As long as it's an open wound, when we get into like really scrubbing and antiseptics, that's when we want to try to get it closed. Because closed wounds will get infected. Open wounds will not. That's why puncture wounds are so dangerous. Because a puncture wound, you've dragged crap in and then it seals on the top, that's a closed wound. So if you get into trouble with a puncture wound, the answer is to make a slit in it and turn it into an open wound, and it'll do just fine. So closed wounds get infected, open wounds rarely get infected. So that's you don't have to hurt people and scrub too hard and all that other stuff. Just clean it out. I usually keep a little dilute peroxide because it doesn't hurt, and just pour it in there. And just keep it clean, change the dressing a couple of times a day, and it'll be fine.
All right. Irrigation, bottled water, and this is where the betadine, where we're talking about a really weak solution. Don't do that. This guy's got this thing where you crush up shells and you turn it into the poultice that not doing. There he is. He's doing it again. Benzoline, if y'all don't know what that is, that makes the skin sticky, so bandage will stick better. And I don't have any of that. Usually you don't buy it in a bottle like that. Usually you buy it in what looks like Q-tips, where it's soaked in the Q-tip and you just rub it around the wound, so when you put a bandage on it, it sticks to the wet bloody skin.
Don't spill it on your boat. You'll never get it off.
Tourniquet, we talked about that. But the point is that if you're going to leave it on, if it's got to stay on, it doesn't kill the limb right away. It will die again. Burns. The traditional folks say there's 3 levels of burn. There's 3 burns. It's like a sunburn. Pour some scalding water on you by accident, something like that. It's painful. Doesn't have a blister. Turns red. 2nd degree burn. Got blisters. So it's partial thickness burn is what they call it. It's called. And then 3rd degree burn is a full thickness burn. Yeah, a lot of people talk about the area is usually black, but it doesn't have to be. Okay, you can get a really bad burn without actually igniting the skin. Okay. So the point is it more than just superficial skin? It's down into the meat, and that's the full thing burned. And the real thing is it hurt or is it no? It's not enough product for it to hurt. And in the first degree burn, I'm the guy that says, give me the solar cane and spray that on it. I'm good. I might put some aloe on there. I think aloe that's got lidocaine in it. Good stuff. And just the main thing is stop the burn, which is, if it was something that spilled on you, get it under cold water, pardon me, not freezing water, but cool water, and cool it off. Same thing with all of these actually, is cool it off with fresh water. Don't get anything out of the freezer, that won't help. It may actually make it worse. But stop the burn, and then in this case, you can put some pain relief on it topically, and probably go from there. Second degree burn, you might need to dress it. You might need to put a dressing on it to keep it from popping. The best blister in a second degree burn absorbs back into the body and not breaks and causes infection. So you can give them pain relievers, put a dressing on it so it doesn't tear open. Third degree burns, now we're talking about something really serious. Don't put anything on this except for what you used in order to stop the burn. Okay? Then just put light dressings on. Keep an eye on it, check vitals, get pain medications, oral pain medications, as long as they can swallow, and seek immediate help. And there actually is kind of like this wonderful little graphic here. This is how you kind of determine how many percent of the body is actually burned. So each limb is 9%. 9, 9, 9, 9, 9, 9. See all them. 18 for the chest, 18 for the back. You end up with one left over, 17 is one. Well, back up. Okay, so for first and second degree burns, these are all good. You want to clean it, and if you put some, the third degree burns, they're talking about all this wonderful specialized stuff that you're probably not carrying. Put a dressing on it, lightly on there, so it doesn't get contaminated, and then head for home. I think their numbers are incorrect. In my scouts, anything over a third degree burn, any bigger than that, requires immediate evacuation. That's the way we operate. But that's a lot of the body. That's like an entire limb in a third degree burn. The chances of infection and other complications are so high. You gotta get them. Gotta get arrested. Anything that's flashed on the face, any burns on the face, need to be handled in an emergency manner, because the problem is that heat might have gone down into the lungs, and that could be fatal pretty quick. So you need to evacuate.
I would throw in there almost any steam burns. Yeah, steam burns are bad because they're it's more than it always looks at first. Right.
They teach everybody.
They never look charred. Steam burns can go deep into your skin in a heartbeat, and they don't look as bad as they are. And like you say, especially anything up near the face, because you're right, the inhalation is really dangerous, and that won't happen right away. It'll be like 2 or 3 hours later. All of a sudden, you can't breathe. Yeah. It's not. It's the upper airway swells and you can't breathe. So with an obstruction, it damages the upper airway and becomes an obstruction. So you end up with a tracheostomy tube.
And here's a picture of that. I've never done that. I've do that. I'll teach y'all that. I'm not confident in that.
Very cruel.
I don't think I could. Because the problem is the reliability. I would be performing things that are outside of my training, and that's one of those lawsuit things.
When they're blue and passing out, you do
All depends on who it is.
it. For that.
Kids on my routine. But this is another one to get people really bad, heat exhaustion, heat stroke when they're out there in the summer, especially when it's sitting around, they're not drinking enough water, they're in the sun, they don't have a bit. It's hotter and it blazes outside. It's hell's front porch in July, you don't know. Yeah. So heat exhaustion is the lower, problem. This is the one that can be resolved by human beings, that are natural human beings. So you get them out of you can notice they're sweating like big dog. Their pulse might rise a little bit, you know, what they don't notice here, what they don't talk about here is usually when they start having heat exhaustion, they start thinking funny. All right, they're not really making correct decisions. They're kind of on mental autopilot, and they don't always engage. So that's one of those things. So the problem is probably dehydration, and get them in the cool spot. Go ahead and dip a towel in water, get it to them, and let them cool off on that if you want to cool them. Maybe water out of the freezer or something like that. Get them in the shade. Get a bunch of hydration in them. Sports drinks are fine. Water by itself might not be good enough. You might need to put some mix in there, electrolyte mix, something like that.
Yeah, there's a lot of stuff out there that's really good for stuff like Liquid IV or
Yeah.
Noon and stuff. And I usually recommend diluting at about 50% of what they recommend. That gets absorbed much faster from the gut. Fresh water, plain water doesn't get absorbed very well. With a little bit of salt in it, it gets almost instantly absorbed. Makes a big difference.
And the problem with plain water is you've been sweating, you're sending them down the road of hypernatremia, right? Which looks the same, but it's different. Heat stroke. This is the big brother to heat exhaustion. So the big normally they say little or no perspiration. That's normally true if it's heat stroke because it's been hot and they're dehydrated and things like that. If it's exertion heat stroke, then they'll probably be sweatier also. Okay. But most of the time it won't be exertion, and you'll notice their skin is dry, their forehead is hot. They really ain't talking at all very well. It's mentally clear. That's not really correct in my opinion, but there's a big difference between being on autopilot and not being able to think straight at all. The problem here is it's a failure of the temperature regulation system in your body. So there's we are not going to be able to fix that. Okay, the only thing we can do is rapidly cool them, hydrate them if they're awake. Okay, and they'll get rescued. You don't necessarily need rescue here on heat exhaustion unless it travels in the heat stroke. And that's based on level of consciousness. That's how you can tell. If they're more or less clear and they're talking to you, but they're just saying funny stuff every once in a while, then this is over here. When they get over here, it's like they're really not making a bit of sense. So that's a level of consciousness loss. And in my world, if you can forget what happened to you, and you're still not in evacuation, but as soon as you forget where you are, I'm evacuating. Okay, because that means we are going in the wrong direction. I didn't know it had 30% mortality. That's a big number. Stroke could happen. I'm not against putting them in the water. Putting them in the life jacket, putting them in the water if the water's cool. If it's 90-degree water, that's gonna help.
Color of your urine.
Yeah.
Color of your urine.
That's the hydration situation. So if you're, clear urine, probably the best. And then orange. Orange is not good. Red is not good. Okay.
Understand that if you're thirsty, you're already dehydrated.
Yeah. So if you've got guests with me or I take the scouts, about every 30 minutes I say, take a drink. Take a drink. When we're hiking, it's every 15. Take a drink. Take a drink. It doesn't have to be a blah, 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 but just take a sip. And in the morning, when we wake up, I say, everybody camel up. You can drink a liter of water right there and then. Okay, you got to pee later. Not my problem. Yeah. This is, I think this is the WHO. Um, Version hypothermia. So now we're talking about wintertime, right? Primarily.
Well, but let's caveat that. One of the biggest problems you get in spring and fall is especially the spring. You get on your boat, it's warm on land, you get out on the water temperature is low, and all it has to do is the wind has to blow over the water. And that's where I see the majority of people have problems with hypothermias in the spring.
And the advice I tell my paddlers, and I'll give you all that insight, is always dress for the swim.
Yeah.
Because you might end up over, dress for the swim. That's what the Coast Guard guys do, right? They're in them little boats and they put on them gunny suits. When it's like 70 degrees outside, that water temperature is 50, and they have heat there. So essentially, you got all these phases. When you first fall into the water and it's really cold, you get a gasping reflex, and that's potentially drowning at that moment. So you literally think about this and train your crew and your passenger. But hey, if you fall overboard in the winter, first thing you want to do is keep your hand over your butt. Go pinch that off so they don't accidentally break in half the ocean. Okay. Then cold water and capacity. So once that's over, you're floating in the water, colder than anything. Right? You only got a few minutes. That's why in the wintertime, I tell my scouts we're going to wear our life jackets. Because putting on a life jacket after you're in the water is hard to do. When it's cold, you might not have enough time before you lose the ability to clip in. Because if it's cold, you'll lose that ability to use your hands, okay, to do stuff. And we're in the life jacket. But once they're in the water, they might get incapacitated. It's going to be a while before they're really going to have a problem. Okay. So if they fall overboard, if they got the life jacket on, and they're not fine, they're not dead. So you can bring the boat around, pick them up, and you might have to pick them up yourself. You might have to have that notion of how do I lift them out of the water? And that's why that life sling is so nice. Right? So you might have to jump in the water with them and put it on, but once you get that life sling on, you can hoist them up. You can hoist them up, get them out of the water.
Norm, a related subject, but from personal experience. Two things. One, think about if you fell overboard off your boat in your slip in February, how would you get back up? I've done that. I fell overboard in February. How do you do that? Where's the ladder? What lines can you use? What part of your boat can you use to get back up by yourself? Because you're down there checking your bills at 9 o'clock in the morning all by yourself. How do you get back ashore? Second thing is if you ever single hand, which some of us do, how do you get back on your boat? Have you rigged your ladder or whatever so you can self-deploy it from the water? Have you got lines overboard? What have you got that you can get back on?
Mike Holston.
There you go.
Remember?
I was there when he did that.
I can't believe he got back on his own boat.
Well, there was no wind.
Oh, I thought. Oh,
There was no wind.
I thought he'd blow up to.
What? Well, the story was he did fall overboard. The boat did go away a little bit. He's at the stern looking at his boat sailing.
Yeah.
But he had a sugar scoop stern and he sailed. It wasn't going fast enough. He swam back to his boat.
I told the kid that one all the time.
Yeah, it's a good.
So the next one is that after a couple of hours, maybe only 30 minutes actually, when you're in the really cold water, you can start having these heart problems. This is when the AED would have been good to have, right? When you do a rescue though with somebody who's having hypothermia, you got to be real gentle with them because the problem then is that the blood thickens when you're in water like that, and you can essentially cause a clot in the around. So what they talk about is when you're doing the cold water rescue, horizontal and gentle, that's good. So if the foot, we have them like this, lift them up out of the water if you can horizontally, It sounds hard to do, doesn't it? If you do it vertical and it's rough, then you possibly could dislodge some big old plug of, hardened blood and makes it way to some kind of organ that have either a stroke or a heart attack.
I'm told that the problem with severe hypothermia, what you just described, is even if they get him back up and they appear to be conscious, problem is they warm up, all the blood is pooled to the core. And that what now starts to happen as you warm it up, that cold blood goes back to the core and they can actually have a death later on. Because, and that's the reason why that becomes an evacuation. It has to be done in a hospital, gradually warm up the whole body. And of course, problem is if you've got even mild hypothermia or medium hypothermia, is they can't generate enough heat of their own body. So you have to have a way of doing external. And on a boat, really, it's another person. Because they just don't have enough, they can't generate enough heat on their own.
So with fractures, when you do that, somebody hurt, which one to do is find out how bad it is before you start treating it. So dots, they don't talk about dots, but dots is basically deformities, open wounds, tenderness, and sore. What is this? Tenderness, sensation. Yeah. So what you're doing is you'll be moving around the body and saying, okay, this doesn't look right, it's dislocated, it's broken, a lot of pain. That's what you're looking to do. I had never heard of that word before. But if you hear a grinding noise, that's probably not good, right? Swelling, that's the other. But look for things like that. We got a couple pictures here that we're going to show you. Here's a picture. I'm looking at something. I'm looking at something else. Good. So hopefully they are awake when this happens, so you can actually find out where it hurts. That helps out. The idea is, see whether you can release them from other, precautions, especially if it's a neck or head injury. Okay? If you got a neck or head injury, you have to assume that there's something bad going on. And so there's a protocol for releasing spinal injury precautions. And that protocol will be more than an hour away. There's no extracting wounds, no medications, things like that. You tend to them not be able to report to you the problem that they're having. If there's no deformity or tenderness, dots are okay in the spine all the way up and down. And then the next thing I always say is make sure that everything works. Okay, get them to hold your hands together. Okay, equal tightness. Then slowly, one by one, say, okay, look up. That hurt? No. Look down. That hurt? No. That hurt? That hurt? None of that stuff hurts. Then you can release these spinal precautions. If you're less than an hour away, it doesn't matter. Just leave them in your cervical column. And you can use these to make a cervical column. It's pretty easy. Just sunglasses and fit in there. And then you can put that toe band around there to hold it. And tight and list. And fine, everything's good. But you have to do this carefully. You don't want to make it worse when you do it. These are pretty handy. The fractures, you're basically going to want to split it. When you do a split, you want to. And primarily, this is so that it doesn't get worse. That's why you're splitting it. You don't want an ordinary fracture to turn into a compound or open fracture. Complex function. I don't know what the because what happens then, when it comes out, then we're opening up to all kinds of infection. We possibly can cause an additional bleed, things like that. So you don't want to lose a fracture. And it hurts, right? So you go ahead and splint the wound. If it's here, then you're gonna have a splint that goes all the way from here to here. You basically go above the joint on either side of where that is. If it's something like a collarbone, you basically are going to split the arm, and that's all you can do right now. Don't do it. There's no reason to try to make them ambulatory if it's like in the feet. Just go ahead and split them up, lean that way, bring them up. If you're out in the backcountry, we split them up so they can walk out. That's what we do. But if it's a broken ankle, they're not walking around with you. Just the movement we did. Have y'all seen Sisson? Movie, a Norwegian movie? Like this always tough guy in World War II. It's amazing. He pushed on with So here's some tools that you would use. Sand splints. See, this is what I was doing there when we kind of made it a cup, put it all the way around on both sides, wrap it up. If you want to just put it on one side, that's good for maybe on the wrist, but not for the entire tibia. And they come in a couple of ways. I like the flat ones. You can unroll it or roll it however you want. This is the thing I talked about FEMA. Okay. Circulation is really important when you're doing these splits because when you bandage it up and it's cut off circulation. So take the shoe off if it's a leg, so you can check CSMs at the toes. Can you feel it tickle your foot? Yeah, you're okay. Some pictures of fractures. But I think what they're trying to demonstrate there is if you've got an open fracture, I think what they're suggesting is maybe a little bit of traction before you split it up.
I think the other thing is for circulation. If you notice that there's no circulation and help's not coming within an hour, that's the one time you do want to try to manipulate a fracture or a limb until you get circulation back. So in the forearm, the femur, and the humerus, the blood vessels run right next to the bones. And if it's too mangulated, you'll stretch those or kink them and you don't get circulation. So that's the one time you might want to try moving a fracture around just enough to get the circulation back.
Very good. This is where they're talking about if it's protruding. I've had two medical references that contradict each other. This one says pour on some hydrogen peroxide. Now for others that say don't do that. That's if you're going to be out for a while. Okay. If literally you're going to be back in an hour or two, don't do all this. Just immobilize it, bring them in, put them in the rescue squad, send them home. But if you're out for months, you might have to do this. This is always the right thing to do on musculoskeletal stuff, right? Rest, ice, compression, and elevation. Sprains, strains, any of them. Those are all good for you. Oh, about ice. The thing about ice, you put it on, it's good for the first 24 hours. So you put it on for about 20 minutes, and then you take it off, and then you bandage it, put it in compression, elevate it. Okay, then hour goes by, you unwrap the bandage, put ice on there again for about 20 minutes. And then take the ice off and bandage back up. So you have compression and elevation. Do that for the first day, and that'll be effective. After the first day, I think heat is what you're going to use. But the idea is to reduce swelling. Swelling causes pain, slows down blood flow, it slows down healing, all that kind of stuff. Carbon monoxide, please. If you've got a motor or a stove, this is a possibility, right? After planning, one of the best things to do is put a carbon monoxide detector on the boat. And you can either get the expensive one at West Marine, or you can go to Walmart and buy it. I've used Walmart. But, you know, being in a marina with the engine running, that's possibly a bad thing, because the carbon monoxide just builds up around your boat. When you got people swimming, running the engine, even if you got even if you're out of gear, you know, that's two things. You got a prop still spinning probably, and carbon monoxide builds up around the boat. Swimmers didn't have a problem.
Swimming under a catamaran at anchor with light wind, you can get carbon monoxide poisoning because it fills up underneath the boat.
Yeah.
Or just in the transom of a sugar scoop.
Sure.
With the engine running, there's a warning on most sugar scoops. Don't let people swim with the engine running.
Sure. Yeah, we did the replacement. A little bit more. So it's colorless, faceless, you don't even know it's there. Sometimes you can feel the tingle in your lip. Let's be a little bit raw. These are the sensors. This is the one that West Marine sells. Over $100. This is the one Walmart sells. This is the one I use. This one's the one I have in the house. And it's not just batteries. They only last a few years in the marine environment. They eventually, and everyone that I've had tells me that they have a problem. What they do is they start alarming when there's no carbon monoxide anywhere. That's how we. The treatment is get them out of carbon monoxide. If you're qualified, you have oxygen on board, that's really the best thing. The half-life of carbon monoxide in your blood is 5 hours. That's a long time, and that's only half of it that's been discharged. It takes a while. Eye injuries, I'm really not going to do much over this. Mostly what you're going to have available to you is going to be saline solution. If you end up with either conjunctivitis because you've been swimming in funky water, really that's about all you got is saline solution. We'll go back. If you end up with something poking into the eye, you need to go back. All right. This thing called photokeratitis. I think they call it snow blindness, probably. I don't know. But just wear some glasses. I grew up with this ozone home, you gotta wear glasses. All right. So there's that's beautiful, isn't it? So they talk about this eye treatment kit. This is what I have. I can kind of, I've got a lot of dogs, but I don't need to have some. This, Overdeck, good stuff. Picture prescription. And what it is it's an eye drop that's got antibiotic and steroidal pain all good stuff.
Hey Norm, do you have a list that you would email of recommended stuff that you might want to have in a first aid kit on a boat?
I have a list. I do have a list. My list is focused on everything that my Sea Scouts do. So it covers backpacking and boating and canoeing and everything. So it's more, it might be more than what you need. I mean, you probably don't need leukotape and moleskin on a boat.
Yeah, I think that's the problem is that a first aid kit's going to be very individualized based on the type of boating you're doing, the age of the people that are in the boat, the medical conditions, how far away from shore you're going to be.
Most
So
important thing is your skill level with that.
well, that too, yeah. So you really need to. I mean, you go online. There's like you'll Google that, you'll find 1,000 things, and most of them are a little overkill. But
The one that, the ones that you see at West Marine, the blue ones, they're actually pretty good. I used to start off with those all the time. And, about $100, not that big. This guy just better than.
yeah, but really, you get an eye wash kit like this, but for most of us, if you get something in your eye that you need to flush out, tap water is fine. The water that you're drinking is fine to wash out most eye wounds. You're probably not going to introduce an infection, and if you have something caustic in there, washing it out instantly is the key. That's why on ships in the Navy, there's eye wash stations everywhere, and all they have is just distilled water in them. And it's just a matter of way of getting the water into the eye in a hurry. That's the thing about eyes when you're on the boat. When you get something into it, it's just something caustic is to flush it out quickly and with a lot of water.
And the reason why I carry it in a bottle rather than we use it from the tap is my pressure water is not reliably available or clean. On my 26-footer, I would not drink the water in there right. The penetrating ions, we leave the penetration in there, put a cup over top of the eye and bandages on there so the eye doesn't get anymore. These are the key medications that they got there. Overdex is pretty good. I've never heard about this. Anaphylaxis. So that's bee stings. You could be eating shellfish. You could have anaphylaxis with a jellyfish sting. Peanuts, things like that. So you never know what's going to happen. That's why you get that health information from your guests, so you know not to feed a peanut butter.
I always keep Benadryl on the boat.
Benadryl's good to have.
Benadryl's one of those, to me, is a must-have. Well, I have anaphylaxis to some things where I just, wake up dead. So it's good to have that stuff. Yeah, yeah. Yeah, yep.
Benadryl's good. I get the generic Walgreens version. A little more.
If it's cheap, it'll dissolve in someone's mouth if necessary. It works instantly.
All right. Hopefully, if they got it really bad, they've got an EpiPen. Right? Hopefully, right? And those things are pretty simple. This is most of the new ones now, you got 2 injections available. This one's only 1 trainer. And basically just find the big thick part of the side. Now, normally you're going to let them do this themselves. Okay? But I'm not against helping somebody. They're having a hard time. I just put their hand around it first, and then I'm no longer legally. I didn't administer. He did. All I did.
These are freaking expensive.
They are. I don't think they used to be.
No, so someone bought out all the generic companies and
Yeah.
jacked up the prices about 500%.
Yeah.
About 10 years ago.
Yeah, and I thought they were putting him in jail.
Yeah, but they didn't lower the price of the EpiPens.
But anybody who's got around, but maybe
It doesn't even. I figure having extra expired
That's-
suspended.
now with my
That's
program,
not
the
free. It's like-
kids go found them. We have to know the problems are before. Swollen lips and tongue, wheezing, severe asthma, obstructed breathing, choking, loss of blood pressure. That's shock. So anaphylaxis is a form of shock. It's like one of the 5 or 6 forms of shock. So this is where they're talking about first treat the shock. Lay them down, elevate the feet, keep them warm, study their life. If you've got EpiPen, apply that. Woo, there it is, Benadryl. And keep in mind with the EpiPen, they may, the EpiPen will be good for about 30 to 40 minutes, and they may end up needing another shot. That's why a lot of these new injectors are a double shot. I don't have a double shot trainer, so I don't even know what it looks like. Head injuries, I think we talked a little bit about spinal frequently associated with a neck injury. Improvised cervical column. See, they got a cushion there, type 3, type 4 rather right there. And a couple of they show fenders here, which you could use paper towel rolls, and just kind of wrap that around. The idea is to immobilize them. If you're a long way away, and you might try to do that if you're trained, try to do that release protocol, but if not, just leave them all bandaged up.
Keep in mind that if you got somebody who's laying down for a variety of reasons and you're on a boat, you gotta secure him so he doesn't fall from where you got him laying down.
Yeah, exactly.
Lee cloths or anything they can do to tie him in place, because he won't have any ability to stop himself and you injure him again.
That's just one.
If you got room.
Huh?
If you got room.
If you have it. I got a nice point, but getting them in there, that's tough. I love this picture of this old lady right here. This is them trying to make room and make it so it doesn't roll around, I think. Sure. Okay, so there's nothing we can do about the brain, right? I mean, literally, it's outside of our control. I'll show you the tool that you might use if you have to. But if it's skull fracture by itself, it's not really bad unless it's mushy. If it's dented, that's bad, right? Because it's impacting on the brain. Concentrate on the ABC, airway, breathing, circulation, neck mobilization. Even if they're conscious, neck mobilization. Rest. Now, this is where me and this presentation is going to go in different directions. They're going to brush off head injuries, and I'm going to say no. Most 90% recover are fully active in 24 hours and return. If they've had any loss of responsiveness, if they any loss of responsiveness, that's important. Okay. If they were knocked out, that's loss of responsiveness, right? If they aren't talking straight, if there's stuff coming out of the ear, all of those things are bad. And I would want to do an evacuation despite with this presentation. Prolonged unconsciousness or prolonged periods of bewilderment or poor performance. They're right about this, but I wouldn't say just prolonged, but any unconsciousness.
I would add to that any nausea or vomiting associated with it,
Right.
or worsening headache.
Worsening headache. So we now know more about concussion since I think this presentation.
Yeah, exactly.
Probably 10 years ago. We actually, in our scouting program, we have a protocol. If you get hit by the head, obviously, and if there's any of those symptoms where we're talking about dizziness, vomiting, a lowering of level of consciousness, any of those things, indication of fluid coming out of the head, things like that, those are all considered burning symptoms. Maybe immediate evacuation. They're showing you eye dilation of eyes. There's the tool you use.
Yeah.
Okay. This is where you mark the spot.
Okay.
There's CPRO. They talk about using CPRO for a lot of stuff. Now you're saying 3 pills is all you're going to have to do. I know the last time I took it, it was 5.
Depends what you're taking it for. It's just one a day. Cipro is once a day. Yeah. Yeah, the timing but until you get to depending what you're using it for and how far you're away from medical care. Hopefully, you're less than 5 days.
You just tell them on the beginner swim. He's fine. He's alert. He's joking. At the hotel, no headache. There's a
Headache.
got worse. He died. That's what would help. If your butt itches, get cream. So here's some discussion about offshore medical kits. And if you wanted me to email this to you, I could do that. Remember, I've got problems with just absorbing everything in this presentation. That other stuff. So, not my normal presentation. I mean, I'm not going to put a quick trait in my first aid kit. I'm not going to do it. The Band-Aids are good to have. I like 2x2 gauze dressings. I like 4x4 gauze dressings. I like 6x6 gauze dressings. I bring lots of gauze rolls. I don't bring eye patches because I use 2x2s. Okay. I bring some adhesive tape. There's two kinds of adhesive tape that you might want to think about bringing. One of them is the white stuff that you get that it's got no latex in it. All right. But the one that I prefer is Leukotape, but it's got latex. The other thing I really like is this Coban. This stuff is just amazing.
I'll say something about adhesive tape, especially since we're a lot of old folks in here with little old lady skin like mine. Is I never put adhesive tape, if possible, directly on skin. I use it to just I wrap with gauze and then just tape the gauze because a lot of us old folks with little old lady skin, when you take the tape off, so your skin comes off too. So especially on hands and legs, skin's really thin. So just be real careful about putting tape on people. Most of the time, it's not necessary. Just have some gauze and the gauze roll or ace wraps, I think, are the most important thing because you can use those for dressings. That's your adhesive tape. That's your pressure for your pressure for bleeding. It's your splint. But lots and lots of ace wraps are good on boots.
And when you buy this stuff, shop for it on him.
Yeah,
Because when
yeah.
you go to when you go to the drugstore, it's going to be uber expensive. And I live by, look at my spares over there. I go by the rule of why buy one when I can have 10 at twice the price. Because literally you buy in volume, price per unit goes way down. You can even get the individual little packets of triple antibiotic. You can get that stuff fairly cheaply. BZK, I like those in individual packets. That stuff is super cheap if you buy like the grocery. They're super cheap. Offshore medical kit, they really go into crazy stuff here. I'm not putting a paddle in my first aid kit. Probably. Okay. The wet supply, soap, solar cane, betadine if you use it, hydrogen peroxide if you like to use it. I don't bother with benzoin. Alcohol swabs. I like BZK swab. And then I kit and everything. So aspirin's good to have, especially for older folks. Teach your crew where it is, how to use it. And actually, I think I got a bigger dosage.
You really don't need it if you're using it for cardiac, baby aspirin's fine. 81 milligrams.
Actually, the training that BCSI gets is exactly the opposite.
Yeah, for if you go to the emergency room, you'll get a baby aspirin.
And they're telling us in ECSI.
It inhibits the platelets, and the amount in a baby aspirin will bind all your platelets and stops them from working.
So, bring a couple different headache remedies, because not everybody can take Advil, even though I think it's more effective. Tylenol, anti-inflammatory. It's, the lead is like a long-lasting version of Advil, in my opinion. Bring Dramamine, Meclizine, maybe. Bring tablets, caffeine. That's when somebody takes the Dramamine, you gotta take the caffeine. Stay awake. Benadryl, again. Imodium. Oh, yeah. You don't want to be.
That's true. That's true. You
That's
say
just
no
enough
more.
said. We got
Say no more.
Um, special ointment for itchy butt. Preparation H. You can use that in more than one use. Okay, it's good for that, but it's also relieves. It's good antihistamine. They always talk about getting an antacid with Pepsid. It's Pepsid AC. It's good stuff. I personally, I actually, when I teach, I don't prefer that. I prefer chewable Pepto-Bismol. It does something a little different. This actually stops the generation of acids, but but it's a one-trick pony. Whereas you can use Pepto-Bismol for that and that. Carrying stuff in my back. So I'm going to keep that all the time. Prescription medications. Very first one is Vicodin. It's Ativan for anxiety.
You're not getting that.
Really?
Yeah. No prescriber is going to give you Ativan prescription for prophylaxis. That ain't happening. You're probably not going to get Vicodin anymore. You used to be able to get it, but now with narcotics being so controlled, you're not going to get narcotics, and you're almost definitely not going to get Ativan just in case.
Prescription strength medication that I think
Zofran is taken over for that. You won't get that anymore either. That's old.
this is really serious features if you got to inject something. EpiPen, but they're expensive. Eye drops. Livervex would be good if you could get it. Ear drops. Silvadine for third-degree burns. That's actually prescription too. I don't know why that is it addictive. Z-Pack, Cipro. That's their suggestions for offshore. If you're going to be near, within a few hours of the hospital, don't follow them. Some things that you might have secondary use. Vinegar is used for a lot of stuff. Ginger ale, duct tape. This guy wasn't kidding, was he? Right. And there's lots of sources for offshore milk that for 11:30.
The Red Cross has a good app you can put on your iPhone. It's just rudimentary first aid. And that's kind of nice to have, kind of like the Knots app, you just have. I'm sorry.
Download.
Yes,
It's not something.
yes, it's data on your phone. No, it's not videos, it's pictures.
The only trouble with everything being on your phone, runs out of power.
That's true.
You can't bookmark it and have somebody check the switch. It's good to have both.
Can't hack this.
That's right. That's right.
The other thing I'd like you to clarify is
Yeah.
when we're within cell phone range, I've been told the best thing to do is call 911.
No, when you're
Not the Coast Guard. Now listen, the reason why.
Yeah.
They are the single point of contact for everybody else, to include the Coast Guard. If you go to the Coast Guard first, Coast Guard then has to sort out where you are and who is the best place to go to.
So,
That's the reason why, but you gotta be there obviously with a cell phone.
but I'll give you anecdotal evidence contrary to.
Okay, well, I'm sure there
And
is.
that is that we were on an event on the Chickahominy River, which, in case y'all don't know, that's like a borderline between two different counties. And we had an emergency, we called 911, and we got the wrong city. So you're depending on the cell phone to get, we said, well, we're hearing this, that, and the other, and it says, I don't know where you're talking about.
Maybe a catch-22 situation.
So if you're out there, you're crossing all of the,
No, I'm talking about Chesapeake Bay, talking about right out here.
well, out there, you've got multiple jurisdictions again. So,
Okay.
so my perspective, I'm not saying the cell phone's not good. My perspective is to have the cell phone, have the number for the emergency medical organization that you want to have to respond. Because you might not get, you might end up, if you are thinking that you're coming over here to bring the patient, you dial 911 in the middle of the bay, you might get the Eastern Shore. They're not going to be able to respond. So, I'm actually the opposite. I say, if you've got a problem, call Coast Guard. That's what I teach. Everybody can do their own. Okay. For you? Yeah. I'll let you.
Back in the preparation phase, you should make a good friend with a physician or an EMT guy and make them your crew. Particularly on a passage. We've had a situation where we had a EMT and we had medical things. He was actually a corpsman.
The advantage of having an EMT on board or a doctor.
Yeah.
Okay. I normally say doctor is much better than an EMT for a lot of reasons. Because EMT they've got.
Yeah.
How about
As a doctor, I would say, I would go the opposite on that. As a doctor, I would want, as a first responder, a nurse or an EMT. Because the doctors, we usually have tools. We have a big toolbox at our disposal. You take away our toolbox and we're like, well, what do I do now? Whereas the EMTs and the nurses are the first ones on the scene. They know what to do before the toolbox arrives. So I'll take an EMT or a nurse every day.
Actually, he was a sniper slash medic. He was a medic. And Steve had a cardiac issue. I had an infection issue. And we were
But the
30
big
miles
advantage-
off sea.
Big advantage of it is that you can let them take care of that while you're still skipping. But that's the big advantage of having that kind of person on board. And I'm joking about the EMT. Two of my scouts have gone on to become EMTs. I'm not sure I would trust them with my life.
Still, maybe better than a car mechanic.
Probably.
Yeah.
All right.
Anybody got any more questions?
Great.
Thank you so much,
Thank you.
Norm. That was great.
No preparation. I usually don't do just a boating related first aid course. So if I touched all the points, let me know.